Okay, so welcome to this PowerPoint presentation on our school's Shine survey results. This presentation was originally given as a live presentation on the 25th of October to quite a number of families from Bishopbriggs Academy who'd signed up for the event, but we decided that such was the nature of what we're going to present to you and the importance of it, we felt it was only fair to have this information, this presentation available to all our families online, hence why we've recorded it. So we're going to just go through the exact same presentation as we did on the 25th of October and hopefully give the families who log on a bit more information on what Shine is, what the results have presented to us as a school, and what as a school we're now planning to do with those findings. So, in terms of what Shine is, okay, it's a study that is conducted by the University of Glasgow, and it's something that last session, and indeed for future sessions, all schools in East Dunbartonshire, primary and secondary, have taken part in. In this school, it was conducted in last spring, so March 2023, and the nature of the study looks at various measures of mental health, positive mental health, subjective well-being, and basically how our young people are functioning in their day-to-day life, asking a range of questions. So first and foremost, the actual response rate. As you can see, we had a really positive response rate. A large section of our school body took part in the survey. And what I should point out at this point is the year groups that are there in front of you are they've all shifted up a year. So the S1s, which took 229 of our S1 cohort last year, they're now our new S2s, and so on and so forth. So when we look at some of the data, particularly for certain year groups, we've now shifted up a year for the current session. We also as a school received a primary cluster report because, as I said earlier, every primary school in East Dunbartonshire took part in this survey, and so some of the data that I'll be referring to doesn't necessarily have a graph as some of the future slides do, but our primary cluster, 215 of our current S1 pupils took part in the Shine survey. So again, we've got similar results to discuss regarding the new S1 as we go through. So overall, the vast majority of our pupils were invited to take part and participate. Some chose not to, and that's totally fine, but with a response rate of 77% overall, we feel that the results give us quite a strong flavour of what's going on with our young people. So as I said, there was a range of questions asked, and the first one looked at, as it says there, how our pupils feel about the report as either excellent or good health. I should say for all these graphs, as the key shows, the red circles and the green diamonds are representative of boys and girls across Scotland, because as one of the slides towards the end of the presentation will show, this survey is conducted not just across all of East Dunbartonshire, but indeed across the vast majority of Scotland and Scottish schools. So where we sit on that, as you can see across the board, is somewhere around the national average, but again, if you look at girls in S5 and S2, slightly below where you'd expect for the national average on it, reporting excellent or good health. These graphs first of all give us some flavour of some of the issues and problems that our young people present and face daily. So for every year group, the young people were asked to kind of rate aspects of their life from 0 to 10. And as you can see quite clearly, appearance, and particularly for girls, rating at 6.5, is markedly lower than the vast majority of the other aspects of their daily life. I would also say that for boys with an average score of 7.7, that is quite a drop from 9.3 and 9.2 for things like family and home. And again at P7 level, so our new S1, home, boys scored 9.3, girls scored 9.0, family, boys scored 9.0, girls scored 8.6, so fairly similar to what our S1 graphs are showing. And for appearance, boys were ranked at primary 7 level at 8.1 and girls at 7.0. So again, a marked decline when it comes to rating themselves on appearance. And as you can see, going through each year group, the trend is pretty much a carbon copy. Really low scores, or markedly low scores, on appearance for boys and girls, but for girls more so. For S3, S4 again, a 2-point drop between home and appearance. S5 dropping below 6 for the first time, so this is our current S6 cohort. And overall, there is the marked trend. So this, first and foremost, an alarming result, an alarming statistic, and something that as a school, and Mr. Orr, who's alongside me for this presentation, will come in a little while and discuss the kind of things we want to do as a school to try and rectify this, or at least do something to help support our young people who feel this way. Then as a kind of a BGE, overall, how happy, or unhappy I should say, how unhappy or with low happiness on the different aspects of your day-to-day time and what you do. So again, a quarter of our BGE girls are unhappy about their appearance. Compare that to all your other light blue graphs there, or light blue bars. That's frightening. And again, I would argue, if you look at the boys, over double any other daily aspect. So although it's 9% and looks far smaller than the 24%, for me I would argue that is still, that's still high. At P7 level, that appearance statistic, for boys it is 5% who are unhappy, but again girls, 14% of our P7 girls, our new S1, reported feeling low happiness around appearance. And again, at the senior phase, a similar picture. The other major factor, or major kind of worry we had when we got these results was around the questions geared around loneliness. So you can see for yourself the percentage of pupils who feel lonely most or all of the time. And again, huge graphs at light blue, and particularly S2 girls and S5 girls, so our new S3 and S6. Feeling lonely, feeling pretty low, 34 and over a third of each of those year groups and cohorts. So again, a frightening statistic. Presenting with low mood, I think the thing to look at there is the blue bars again, for certainly S2 and S5 girls, who are not only high but above the national average. Low mood, I should say, for P7, so again our new S1s, boys were 22%, girls 41%. So if we had a P7 graph on the end, that would be higher than the S1s say, and again, quite worrying. So not only, we're doing this at a secondary level, but way back at primary level, the same patterns, the same results are tending to emerge. Questions then posed on, have you ever hurt yourself on purpose? And again, although the majority of the pie chart there is saying no, there are still alarming rates. 24% of girls saying yes, 16% of boys. And in terms of frequency of self-harm over the past 12 months, some alarming statistics again. Now when you compare that to myself and Mr. Orr, who I say he's going to jump in a moment and talk about kind of the things we've done since we got these results. But we attended a Shine National Conference a few months after we got our Shine data back, and nationally the picture is very similar. So I'm going to share with you just a couple of bits of data that we took from that conference. I should say, as it shows you there, that this is taken from 2020 to 2022. So the more recent data will come into kind of this session's national conference. But again, as I said earlier, lots of secondary schools taking part, and not just East Dunbartonshire, so Scotland wide. And again, with low happiness, focusing on appearance, marked increases, girls compared to the boys. But I would argue all those stats are higher than I'd like. And as a parent, I'm sure you'd agree, it's worrying statistics. So I'm going to hand over now to Mr. Orr, who's going to go through what we've done as a school since then and what our plans are for this session to try and help support our young people the best we can.
So as Mr. Rushworth said, I'm Mr. Orr. I am a teacher of wellbeing at Bishop Briggs Academy, and what that means is that my role is focused on improving the social, emotional and mental health of the young people in the school. So we took the data from the Shine survey, and that was very informative, but what we were really interested in finding out is why pupils felt this way. The Shine survey showed us how pupils felt, but we wanted to know why they felt that way. So what I did was I opened up a series of focus groups to all pupils across S1 to S6, and the data on the slide shows S1 to S5 because S6 has taken place this week due to arrangements around assemblies. And what we decided to do was to take a range of pupils across S1 to S5 and through the different houses, as you can see from the table, and ask them maybe more open questions around what they thought around the issues were, around why pupils felt lonely, why they struggled with their appearance, but also to find out what they thought would be a useful solution to these issues. Because as adults and people who have been to school years ago, we didn't necessarily feel that we would have all the answers in ways that we can help the young people on these issues. So we gathered the focus groups and we asked the following questions. We asked them about their support for mental health in the school already. We asked about the support, the wellbeing base that I run provides, and what we offer and what we do. We also asked them about the two major low scored aspects of the survey, which was the appearance question and the loneliness question, and we asked them why they thought pupils felt that way. We then asked them what support they would feel they had already around these two questions, but also what support would be useful in the future. And then we asked about any other additional support they would like, and we opened up the groups to further comments and discussion about anything that may have been brought up in their mind around the discussions. And it was a very useful activity, and it gave a great opportunity for young people to give their opinion and to talk openly about where they felt the school was working well and where they felt the school wasn't working so well. And then we decided to try and act on this feedback. So the feedback we received was in some aspects very good, and some aspects shown areas where we think we can improve the support we offer to young people. So on the surface, pupils felt well supported. They knew about their guidance teachers, they knew about the wellbeing department on the whole, and they knew about the mental health ambassadors, and they were brought up by all different types of pupils, and they felt that they were all good areas of support. The mental health ambassadors, just to point out, are young people in S5 and S6 who have volunteered to be mental health ambassadors, and these people are publicised around the school, and they are there to help young people and to talk to them about their issues if they feel that they would find talking to a person of a similar age more comforting than talking to an adult. These pupils are trained, and they will often go on to pass things along to a trusted adult in the school in order to support pupils when they've got issues that are more severe. When we asked the pupils if they felt supported, they generally said yes, they do. But when they were pushed further and asked about, on specific occasions, if they could think about a specific occasion where they maybe had a friend who suffered from mental health issues, whether they were supported well, often the answer was actually no. Overall, pupils felt there was a high level of trust in school staff, and they all felt they had an adult that they would be able to go to for support, which was really positive and definitely was encouraging for us to hear. The amount of support or the ease of access was described as an issue. Although pupils all said they felt comfortable talking to their guidance teacher or knew that their guidance teacher was the person that they could go to for support on these issues, The guidance department is a big room. For those of you who've been in the school, it's a big room with many members of staff in it, and many pupils coming in and out of the office every day to look for support on things or to talk about things. And some pupils maybe raised the fact that if they wanted to talk about something very sensitive, they didn't necessarily feel comfortable speaking openly in a room with lots of different people in it. They also said that the wellbeing base sometimes feels inaccessible. This was due to the fact that the door isn't always open, and that it was closed a lot of the time in the day when either there were groups going on inside or there were no staff members around in the wellbeing base. And they also said that services such as a school counsellor lacked capacity, as some pupils had found that they were waiting a long time to get access to the school counsellor. There was some demand in the groups to talk about having wellbeing groups for further up the school. At the minute we have wellbeing groups in S1 and S2, and some people suggested that that would be something we could provide later on in the school for those pupils who need it. Some further headline findings. Pupils felt, when they started getting into the questions around loneliness and appearance and what the issues were, what was interesting to hear is that pupils were able to identify some of the issues very quickly for appearance, but not necessarily felt comfortable with solutions. And then the loneliness, some pupils felt found it more difficult to identify the reasons for pupils feeling lonely, but came up quite quickly with some sort of solutions that they thought would help. So the main thing that pupils came up with when asked about appearance was social media. I think this is probably quite natural for all of us. We probably believe this and have heard this before, but the pupils are saying that social media is having a massive impact on their negative feelings around appearance. But the pupils do feel that they're stuck between a rock and a hard place, because for them, social media has got cultural capital associated with it, knowing things that are going on in the world, being able to talk to their peers outside of school. They normally use messaging services within social media apps rather than traditional text messages and things like that. So they feel stuck between a rock and a hard place, because they feel they should be using social media, they need to use social media to maintain their kind of social status, but also can quite quickly recognise that social media is having a negative impact on their mental health around their appearance. And another thing that came up a bit more closer to home was the idea of comparing themselves to each other between pupils, and this was a contributing factor to negative feelings about their appearance. There were conversations around the idea that if a pupil changed their appearance, there was pressure on others to change their appearance in a different way in a certain social group. And I think this is something that's worth reflecting on at home, about the idea of comparing to others, and having that kind of self-worth being based on how a pupil compares themselves to other people. Pupils express issues about negative comments between pupils around appearance, and that's something that I'm sure we would all recognise from our time in school, but not something that we really want to happen in Bishop Briggs Academy. A positive piece of feedback was that uniform was seen as a positive leveller, and the fact that they're reducing comparisons between pupils, because pupils can't have comparisons around what they're wearing and how they're dressed. But some pupils did think that this was undermined by the fact that in PE they were able to wear whatever they wanted, within the regards of being PE kit rather than having a school kit, and that's something that was interesting feedback. So that was just some headline figures from the feedback, and now I want to talk quickly about what we have acted on already at the point of this recording, and what we want to do further on in the year. So in the short term, we wanted to open up the wellbeing base every lunchtime to change that negative aspect of whether the wellbeing base was open to all and accessible to all. This has now started. Every pupil's been told in assembly and reminded that the wellbeing base is open to them at lunchtime, and so all pupils, whatever's going on in their life, will have a quiet space where they can come and sit, get some support from myself or the mental health ambassadors throughout the week, or even just have a quiet place to kind of just relax and get away from the busyness of the school. So if you think your young person at home can use that, then please remind them of that opportunity. We have also looked to tackle the idea of accessing support when you're feeling it's a sensitive issue and you don't want to talk openly about it in front of other people, and we have created a private QR code system where pupils can get support from their mental health ambassadors, and these are all up around the school, and the guidance department have also committed to creating the system of their own for QR codes where pupils can get access from support from their guidance teacher through a more private means, through QR codes around the school they can access on the phone, rather than having to step into that busy office and feel that they can't necessarily speak openly about their issues. The other thing that we thought was very helpful was, although the mental health ambassador team was known about, who was in the mental health ambassador team, because that changes at the start of every session, wasn't at this point very visible, and so we have now got display boards around the school which shows photos and a little bit of a bio of each member of the mental health ambassador team, so people know who they can go to for their help. Because in the feedback that we received, what was very interesting is that there was a big split between where people felt they could get their support. Some were very, very happy to get support from their trusted adults in the school, like their registration teacher, their guidance teacher, or just a trusted teacher. But some pupils felt that those teachers maybe would be a bit out of touch and maybe wouldn't necessarily be able to relate to the issues they're going through. So another group of pupils definitely felt that the mental health ambassador team was very useful, because they had a much better understanding of the context that young person is living through, because they themselves are also a pupil at the school. So that's why it's important for us to have both avenues available to support. But as I said earlier on in the presentation, I just want to stress that any serious issues that get raised with the mental health ambassador, they will be passed on to guidance teachers, the relevant guidance teachers for your child, so that the proper child protection process can be followed. Longer term, medium term, we are looking to tackle some of the bigger questions around the feedback. So some of the suggestions from the focus groups around tackling loneliness included accessing extracurricular clubs, and at the minute there's an audit of attendance at clubs, and we're gathering further feedback on opportunities for clubs to cater to wider interests. We are creating more options for senior people to either take part in lunchtime clubs as helpers or to have their own specific clubs, because that was something that came up. A lot of the senior people thought that clubs were more designed for the younger pupils in the school, and that as they got older there was less space for them to kind of hang around together as their age group and to take part in things that are interested to them. The mental health ambassadors are going to run some sessions on normalising views around appearance. They actually came up with this themselves, and they thought it was a good idea around them being relatable to the pupils, because they are teenagers themselves and they've probably experienced similar things. And we just thought, even though the question of pupils' views of their appearance and fighting social media is not something necessarily we can do on our own in Bishop Academy, we want to be able to normalise discussion around this and try and make it much more comfortable as a point of pupils not thinking that they're suffering on their own on this situation. In the new year term, we're going to run a wellbeing week, which is going to have a dual focus on building connections to tackle the loneliness and the impact of social media on appearance. And overall, just a broader point of philosophy, I suppose, around what we want to do going forward is building a culture of kindness in the school. This links to the kind of negative comments we've seen about appearance, and this will contribute to work within PSC and wellbeing groups and work across the school. And then when I was making this presentation for the presentation to parents the other week, one thing I thought about was some questions we might get about what you could do at home to kind of help these matters. And I've put a few points here on the slide just to kind of towards the end of this presentation, just to say what could you do to support. So first of all, open conversations around mental health in general. The more we talk about these things, the better it gets, and I think that's something we're all as a society are getting better at, but we could do more for. So please do talk at home about mental health issues and have open discussions around them, because that will support the young people who are struggling. You may want to use this presentation as an initiator of the conversations at home, so once you've read it, you could bring it up as topics in conversation. The social media point, it's having a significant negative impact on young people's mental health in a number of ways, and I would really recommend making sure you're aware of what time your child spends on social media, who they're talking to and what they're seeing on social media, and maybe think about the kind of parental controls that are available through mobile phones around accessing these apps. This is something we're going to run sessions on later in the year, and so please keep an eye out for those, and if you're interested in having that support, then we'll be able to support on that. If you've got any concerns or feel your child needs any support on any of these issues, please don't hesitate to get in touch with your guidance teacher. They're overall responsible for your child's pastoral support, so they'll be there to help you. And when it comes to loneliness, please do encourage your child to take part in extracurricular clubs at school. There are dozens and dozens of clubs in school that they can get part in, including sports, including band, including Taylor Swift Club as one of them. So there's clubs for all interests. And also please advise them that they can start their own. So if they want support and starting their own club, we can help with that as well. And obviously extracurricular activities don't have to happen inside Bishop Briggs Academy. If you wanted to encourage them into extracurricular elsewhere at school, that is also good for building social networks and reducing this impact of loneliness. And as I said earlier on about parental workshops, we're planning to deliver throughout the course, so please look out for a letter about those. We're going to have parental workshops on social media, anxiety, building resilience, importance of sleep and nutrition, amongst many others.